Hey there, everybody, and welcome to this brief presentation on reintegration anxiety, finding your new normal after a pandemic. I'm your host, Dr. Elise Snipes. In this presentation, we're going to explore strategies to help people with reintegration anxiety. There are still a lot of people who are afraid to go out and do those things that they used to do pre-pandemic. So we'll talk about ways that people might start exploring whether it's something that they feel they can do safely. The following slides provide examples of systematic desensitization. This is for educational purposes only. A specific step-by-step guide that is individualized for you can be created with a professional counselor or social worker. I don't want people to take information from this slide, try to apply it, and then get overwhelmed and make the situation worse. This is just to help you understand a little bit more about some of the techniques that we use in counseling to help people with anxiety. The first thing that you want to do for reintegration is create safety. When people are feeling afraid, that means they feel like there's a threat. Well, the opposite of threat is safety. So creating safety is going to be the base of what you need to do for reintegration. Start by identifying your fears. What is it that you are afraid of? And be specific. You may be afraid of getting sick. Okay. What else are you afraid of? And there could be a lot of things. You may be afraid of other people who are not observing the same protocols you are. You may be afraid of going to the grocery store and touching things that other people have touched. So identify your fears so you know what those triggers are, what those anxiety triggers are. Validate your feelings of vulnerability. You thought I was going to say, try to tell yourself that everything's okay. Well, you know what? When you have been immersed in an environment where pretty much 24/7 for a year and a half, we've heard danger, 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 this is, critical. And we have taken steps that haven't been taken in, over 100 years with quarantine. It makes sense that people may be apprehensive about reemerging and resuming pre-pandemic activities. So your feelings of vulnerability, your fears are real. And acknowledging that and saying, okay, I feel anxious. Does that mean that there is a reason to still be scared? And we're going to talk about that in a minute. But remember from my other presentations that I've talked about your feelings serving sort of like smoke alarms. Every time the smoke alarm goes off doesn't mean that there's a fire, but it means you need to get up and check and see if there is a fire and take adequate steps to keep yourself safe. Once you've identified your fears and validated your feelings of vulnerability, then identify any past traumas that it may be triggering. When people were put into quarantine, sometimes it triggered past traumas. They felt powerless. They experienced feelings of distrust throughout this process that triggered past traumas. They felt unsafe. And anytime you're in a traumatic situation, a lot of times you're going to feel unsafe. So it's important to recognize that the anxiety you're feeling may be coming from more than just this isolated event. It could be stuff from your past that's informing the way you interpret this event, and your brain's going, okay, we've been here before, and this is really bad mojo. So it's important to identify past traumas that are being triggered and really look at what's similar and what's different, which is where we go to this next step. Once you've identified your fears and validated your feelings, identify the facts for and against your fears in the present context. What happened 20 years ago, 10 years ago, 10 months ago may be different than what's going on right now. For example, 10 months ago, I think about somewhere about there, we didn't have a vaccine. Now we've got a vaccine. So going out into public could have been a lot more dangerous 10 months ago, whereas now, if you've been vaccinated and others have been vaccinated, the chances of contagion are dropping significantly. Now, does that mean that's all you need to do? Well, a lot of these things are going to be a personal decision, but it's important to look at the facts. Is it, even though 10 months ago it may not have been safe to go out into public places or spend a lot of time in crowded public places, now, what is the science telling you? What is the fact? What are the facts for and against your fears? And I do say for those fears because your fears have some grounding in facts, but it's important to look at them in the present context. Right now, currently, is this fear still accurate? Identify the aspects of the situation that are within your control. Getting your vaccinations, wearing masks, good hand hygiene, the same thing we've been saying, since this started, are still really important. If you are concerned about getting the virus, then it is important that you follow all the guidelines and you take any steps practical in order to protect yourself. So if you get the vaccination, if you've had the vaccination, you've had both doses, and you wear your masks and you practice good hand hygiene, those things are within your control. So if you do all those things, what is the probability that you will get sick, and you will get sick enough that it will be terminal? So we really want to look at that, because the research has shown that even people who get vaccinated, if they do by some small chance get sick, the chances of them dying are significantly lower. So the chances of them getting it are significantly lower, and the chances of them dying are even lower than that. So it's important to really look at the science, just like they've been saying all along. Journal prompts. Identify 3 fears related to resuming pre-pandemic activities and the facts for and against those fears in the present context. Another thing that you can do to help you direct your energy is to define a rich and meaningful life. What things do you want to have in your new normal? What things are important to you? Because those are the things that you're going to start working toward. You're going to start saying, okay, I want to go back to the gym. So I need to work on being less anxious about that and taking steps so I can do it safely. And maybe you want to go back to working in an office. Maybe, you want to go back to in-person school. Whatever it is, what things are important in your rich and meaningful life? And of those, what can you already do? Maybe you like hiking, and hiking is something that is, on that low risk scale, since it's outside and you can be, very, very socially distanced. But what are those things that you can do right now that are part of your rich and meaningful life? And what are those things that you want to do? And then start using these techniques to move toward being able to do those things. So even when the facts are on your side, you go through and logically, that the chances of getting sick are very, very low because you're doing all the things that science says you should. After being immersed in near constant reminders of the danger, or heaven forbid, experiencing the death of a loved one from the virus, it's common to feel anxiety when leaving your safe space. You've created this environment that is virus-free, and you feel safe in that environment. It's something that you are able to control. But when you leave that can be very anxiety-provoking. To address that, We use a technique, or one thing you can do is use a technique called systematic desensitization. And this is a technique that we use with people who have phobias about spiders or flying or anything else that they want to conquer. They have significant fears about that. So what we're doing is addressing those significant fears about resuming some of these activities. So identify one thing that you want to start doing that still causes you distress. And let's say somebody says, I want to start going back to in-person work. I want to start going back into the office. Okay. Well, you want to do that because you're tired of working from home and having to deal with the dogs and the kids and those sorts of things. But the thought of going into the office and being surrounded by people all day long is overwhelming. Okay. So the first thing you're going to do, you're not going to go do it right away. You're going to think about, you're going to envision doing it responsibly. And when you start to envision it, you're going to rank your anxiety on a scale from 1 to 5. 1, not a problem at all. 5, almost paralyzing anxiety. So you're going to figure out kind of where you're at on that scale. And what you want to do is get to the place where you can envision yourself doing this without really triggering your anxiety. You can envision yourself doing this and go, you know what? It'll be okay. And it's going to take time because your brain is telling you, screaming at you, are you sure about that? First thing you want to do when you think about doing it responsibly, what are you going to do to protect yourself? So obviously, we've already talked about vaccinations, masks, hand hygiene, but also if you're going into a public place, social distancing. You know, what other things are you going to do to protect yourself? Maybe when you get to your office, you are going to choose to wipe down your desk with a disinfectant cloth. You know, some people will have different things that they're going to do in order to help them feel like they are in a safe place. What does the research say about the probability of illness when you do all of those things that are within your control? You know, if you get the vaccine, then your chances of getting sick drop significantly. And your chances of dying from the illness drop even more. If you wear masks, you know, that may help. If you wash your hands, we know that helps. If you wipe down your spaces, that can help. You know, when you start doing those things, and then when you add social distancing on top of it, you know, all of those things make a significant impact in your likelihood of getting sick. So when you put all of those things together, you're really putting probability on your side, so to speak. What else can you do to help yourself feel safe? Now remember, you're not doing this yet. You're just envisioning it. You're envisioning, what am I going to do? How am I going to do this responsibly? And what else might I need to do in order to feel safe? Maybe you need to, at least at first, have a buddy, a human social support. Or maybe you need an emotional support animal. You know, there are a lot of ways that you can increase your sense of support. If you're going back to work, maybe you can talk to your boss or you can talk to human resources and identify things that you can do within the organization to help you feel safe. What fact-based reassuring statements can you tell yourself? And I want you, this is kind of one of those journaling prompts, if you will, make a list of those fact-based reassuring statements that you can tell yourself. For example, I've had the vaccine, I'm practicing good hand hygiene, you know, all of those things that the science tells us will help you stay safe. As you repeat those statements to yourself, breathe in and out slowly. So when you start to feel anxious, you're going to breathe in and you're going to go, I've had the vaccine, I'm washing my hands, I'm doing these things, but breathe in and out just very slowly. When you breathe slowly, it triggers the rest and digest, which tones down regulates the HPA axis, or your threat response system. Continue to visualize yourself doing the task and returning home safely. When you feel your anxiety start to rise, just stop, acknowledge your feelings, and repeat those safe statements to yourself until you can get that anxiety to go down. Repeat this process over and over again until you can visualize yourself going to that place without getting anxious. Now, I don't mean sit there and do it once, get up, go to the bathroom, and do it again. You may need to do it, once or twice during a day, and then the next day, visualize. Your people don't do systematic desensitization all in one day. You want to take it in small doses, because what you're doing is kind of retraining your threat response system. You're retraining some of those cues in your brain to not elicit as strong of a fear response. So once you can visualize yourself doing this and not get anxious, then you want to consider going to the location, not inside, but go to the location. Sit in your car, sit right outside on the patio, wherever, and envision yourself actually going in and go through the same process again. Once you can visualize it, you're in your safe place at home and you can visualize it without causing anxiety. When you go to that place, you're there and it can feel overwhelming. So, your anxiety levels are going to rise again. That's fine. So practice going there and working on de-escalating yourself with that same process. Finally, once you're able to sit outside, you're able to drive there, not get anxious, sit outside, not get anxious, then try going inside. And going inside, you may not want to try, all right, today I'm going to go to work and work 8 hours. It's important to, again, do this incrementally until you feel like you've got a hold on your anxiety. So you may only go into that location for 5 minutes and then walk out. As you do this, as you repeat this, going and sitting outside and then eventually going inside, each time you do it and you're able to de-escalate yourself, you also want to note each time you do it, and guess what? You don't get sick. So then you can look back and you can say, all right, I went there 15 times and I didn't get as much as a sniffle. So that can give you evidence that what you're doing is working. Other things that can help you with this process: minimize stimulants before doing this activity, before doing a stressful event, because stimulants will increase the variability or the reactivity of that threat response system. Ensure your blood sugar is stable and stay hydrated. Both of these things can also contribute to an exaggerated stress response. Bring social or emotional support with you. Now, it could be a person that comes with you. It could be somebody you're talking to on the phone. It could be your emotional support animal, whatever works for you. But sometimes people feel more comfortable if they've got support. And if your organization is bringing you back to in-person work, they also may have a buddy system where people can support one another coming back into the workplace. When you are going to these public places, choose less busy times. Going to, the office when everybody's there and it's buzzing and there are clients coming in and out, that is not the optimum time. Go first thing in the morning when people are starting to trickle in, or in the evening after most people have already left, while you're getting used to being back in that environment. And go slowly. I already said this, but it's worth repeating. It's important not to push yourself too quickly. And as I said earlier, it's important to work with a counselor or social worker who can help you design your own desensitization process so you don't end up triggering more anxiety or exacerbating other pre-existing mental health issues. But systematic desensitization can be extraordinarily helpful for a lot of things. I've used it with people, helping them with fear of flying, public speaking, with adolescents who are transitioning from high school to college, and that anxiety about going to college and trying to find their classes and all that other stuff. For some adolescents, that can be very paralyzing. And so this can be helpful in a lot of different situations. Final journal prompt. What are you most looking forward to in your new normal?